Hi, my name's Ashton. I'll be your nurse today. So I'm going to do a head-to-toe assessment on you. First, I'm going to provide patient privacy. And can you tell me your name and date of birth?
Madison Williams, 9/22/19.
Okay, awesome. So starting out, the patient seems relaxed. She doesn't seem to have any anxiety or be in any discomfort. Her skin is appropriate for her ethnicity. She doesn't appear to be in any pain. I don't see any visible lesions or wounds on the body. No signs of sickness, and she's sitting upright. So first, I'm going to start with your hair. Just inspect it. So it's a sandy blonde color. I don't see any evidence of pest. Check the other side. No sores or lesions on the scalp, and it's equal distribution. No bald patches. Next, I'm going to go check the face for edema. So no edema in the face. Go down. The skin is warm, and it's dry. No excess moisture. I'm going to check the skin turgor. The skin turgor is fine. No signs of dehydration. And then again, I will check edema in the forearms. And then in the legs, so the skin bounces right back, returns to its normal color, so no signs of edema. And then, if I can see your nails, please. So there's no jagged edges, no breaking or brittleness. They are a nice pink color. The capillary refill is less than 2 seconds. And if you can make a heart for me. All right, and there's no signs of clubbing. Moving on to the head and neck, you can feel the temporal arteries. All right, so that's at a 2+. Carotid, at a 2+. And then I'm also going to listen to your carotid arteries. All normal. Didn't hear any signs of blockages. Moving up, if you tell me if you have any pain or tenderness in your sinuses, the frontal and then the maxillary. Okay. I'm also going to palpate your lymph nodes. We've got the preauricular, postauricular, the occipital, tonsillar, submandibular, submental. Cervical chain, supraclavicular. So I didn't feel any lymph nodes, which is normal. If you can clench down for me. All right, so cranial nerve 5 is intact, and if you can puff your cheeks and smile and frown. All right, so that's normal. So cranial nerve 7 is intact. And then I'm going to palpate your thyroid gland. You can just take a sip of water for me. So I could palpate the upper lobes of the thyroid, but there was nothing abnormal. And then cranial nerves 9 and 10 are intact because of your swelling. And then I'm going to move on to the eyes. So first, I'm going to have you look up. So the conjunctiva is nice and pink, sclera is white. I don't see any puffiness of the lids or any swelling. And I'm going to have you read the lowest line you can for me.
2843.
Okay, if you can cover one eye and read just the second line.
874.
Okay, and the other one.
874.
Okay, so cranial nerves 2 and 3 are intact. And then I'm going to go from the side. Pupils. All right. So both pupils constricted. They are equal, round, reactive to light, and accommodating. And then if you can stare at a spot on the wall for me. All right, and the corneal light reflex is reflective on the same part of the pupils. And then I'm going to have you just follow the pen light with your eyes, not your head. All right, so it's the cardinal fields of gaze. Cranial nerves 3, 4, and 6 are intact. And then lastly, it's going to be a bright light. I just need to check the red light. reflex. All right, and it is present in both eyes. So moving on to the ear. I'm going to palpate this. Just tell me if you have any pain or tenderness. I'm going to look inside and check out the tympanic membrane. Alright, so I do see a little bit of wax, but no redness. The tympanic membrane is a pearly white, and I do see the cone of light reflex. Nothing to be concerned, no redness or swelling. And then on your nose, do you have any pain up here? Okay, so your nose is midline and symmetrical. I'm going to look really quickly. So the mucous membranes are pink and moist. The septum is midline. I don't see any deviation. And then I'm just going to have you breathe in for me. And the other side. Okay, so the patency of the nares is good. And if you can do that one more time. Can you tell me what that smell is?
Amazing.
And the other?
Beautiful day.
Okay, so cranial nerve 1 is intact. And then with the ears, I'm going to whisper some words behind. I need you to repeat them back to me.
River tree sun. Coke Sprite citizen.
Okay, so that is cranial nerve 8 is intact. And then looking at you, the trachea is midline. I forgot that with the thyroid. And then when I palpated, it was also midline, so no deviation there. And then I'm going to assess your valve. If you can say light, tight, dynamite for me.
Light, tight, dynamite.
So cranial nerve 12 is intact. So starting with the lips, they are pink and moist. I don't see any dryness or cracking. The gums are intact. If you can open for me. There's no sores in the mouth. I don't see any blisters. I see evidence of all teeth. And then I'm just going to you stick your tongue out for me. All right. So there's no sores or blisters on the tongue. No signs of dehydration. And then if you can just stick your tongue out and say ah.
And
All right. So then that's stuck on your tongue. So the uvula did move, so that's cranial 9 and 10 are intact, and then the tonsils aren't present, so that is a grade 0. So next I'm going to go to the lungs. I'm going to have you just inspecting your chest. I don't see any signs of respiratory distress, no accessory muscles in the movement. And then assessing the back, you are sitting up straight, but no distress. I don't see any abnormal breathing movements. I can actually have you turn this way for me. Alright. So if you can do a deep breath for me. Alright, one more time. Okay, so my fingers did expand the same, so that's symmetrical lung expansion. And then I'm going to start listening to your lungs, starting at the upper lobes and moving all the way down to the lower. So if you can breathe in for me. And again. Again, please. And again. Breathe in. Again. Alright, now one more time. Last time. Okay, so I did hear normal breath sounds, no wheezing or crackles heard. Moving on to the heart. So I already assessed for the edema. There's no edema present there. I'm going to go ahead and listen to your heart sounds, starting at the aortic. And if I just stick this under here. The pulmonic. Mind if I go up and listen to the tricuspid? mitral. Alright, so I didn't detect any abnormalities, just the normal heart sounds, no arrhythmias or murmurs. You can just lay on your left side for me. I'm going to feel for the maximal impulse. Alright, so I can feel the point of maximal impulse. And then I'm going to have you lay down and assess your pulses. So I'll start with the feet. The dorsalis pedis is at a +2. Posterior tibial +2 bilaterally. Assess the popliteal. So it is at a +2 on the right side. And at a +2 on the left side. So I'm going to have you stay laying down. I'm going to assess your abdomen. So there's one piercing. It's symmetrical. I don't see it expanded more on one side than the other. And so first I'm going to listen to your sounds in your abdomen, starting in the right upper quadrant. So bowel sounds are present in the right upper quadrant, in the left upper quadrant, in the left lower quadrant, and then they're also present in the right lower quadrant, so they're present in all 4 quadrants. I'm going to palpate your abdomen, so let me know if you feel pain anywhere. Any pain or tenderness? Alright, and then I'm going to percuss. Alright, so I did hear tympany everywhere except in the right upper quadrant, so I'm going to palpate to see if I can feel your liver. And the liver is not palpable, which is normal. And then I'm going to have you sit up. I'm going to have you turn around one more time to feel your spine. Is there any pain in your spine?
Nope.
Alright, and I don't feel any bulging on the spine, any protrusions. And it is in alignment until you get about midway down, and then there is some curvature in there. But she was previously diagnosed with scoliosis, so it's what expected to see. And then if you can turn back around, I'm going to have you do the movement that I do. Your head to the side, and up and down in a circle. Alright, you can put your arms out, flip them over, lift them up, touch your shoulder. Alright, and then your legs, if you can lift your leg up. Alright, and then point your foot, flex, foot back. Alright, so I'm going to go ahead and have you press on my hands like you're pressing the gas. Alright, and then if you can grab my fingers. Alright, so strength is good, equal bilaterally. And then I am going to have you close your eyes and touch your nose. Both hands, and then can you touch your ankle to your shin? Alright, so the patient shows good coordination. I'm going to have touch a few spots. This is going to be sharp and this is going to be dull, so if you can tell me what you feel where, close your eyes. Okay, last one. All right, and then if you can answer some questions for me. What's your middle name?
And
Okay, and where are you right now?
University of Charleston,
And what is the year?
2019.
Awesome. All right, so the patient is oriented and aware of the date and time and alert. And then I'm going to get your vital signs. All right, temperature is 99.3. Let me switch. Oh, this one's thinking too. Are your fingers cold? Let me see this hand. It's like not doing anything. All right, I'm going to try you. I'm going to try you. I'm going to attempt to feel the brachial pulse. The brachial pulse is at a +2. Just going to assess the radial pulse. So the pulse is 82 and the respirations were 18. All right. So first, I'm going to get the systolic threshold. All right. So the systolic threshold is 132. And then for the blood pressure. All right, it was 136/78. And then I know I asked with most body systems, but are you feeling pain anywhere?
No.
Okay, and then I'm just going to double check to make sure got everything. And that concludes this head to toe assessment. Thank you.